Dawn by Mohammad Reza Shajarian. This is Democracy Now!, democracynow.org, The War and Peace Report. I'm Amy Goodman with Juan Gonzalez.
Well, President Obama has set health care reform as his highest domestic legislative priority and has begun an intense push to get a bill through Congress by the end of the summer. Obama spoke at a town hall-style meeting in Green Bay, Wisconsin, Thursday, where he defended his call for a government-sponsored health plan to compete with private insurers.
The single biggest problem we have in terms of the debt and the deficit is health care. It's Medicare and Medicaid. That is, when you hear all these projections about all these trillions of dollars and red ink going, out as far as the eye can see, almost all of that is because of the increase in Medicare and Medicaid costs that are going up much, much faster than inflation.
Private insurers have opposed a government-run program out of fear they'd be unable to compete with its cheaper costs. Obama did not, however, address his progressive critics who advocate the creation of a single-payer system that would eliminate for-profit insurance companies entirely. But Obama's plan to create a public option to compete with private coverage is opposed by Republican lawmakers, private insurers, and most recently, the American Medical Association. Senator Max Baucus of Montana, the chairman of the Finance Committee, who is leading an effort to draft a health care bill, said Thursday the public plan would take the form of an insurance cooperative that would be owned and operated for the benefit of its members, but not run by the government. The Senate Finance panel plans to take up the legislation on June 23rd.
On Monday, President Obama is scheduled to address the American Medical Association, the nation's largest doctors group with 250,000 members. They've expressed strong opposition to a government-run plan, but as our next guest describes, this is nothing new. Over the past 70 years, the AMA has fought almost every major effort at health care reform. Mark Haney is the director of Metro New York Health Care for All campaign, co-chair of the National Universal Healthcare Action Network, also co-hosts the show Health Action on Pacifica radio station WBAI, joining us in our Firehouse studio.
Thank you.
It's good to have you with us,
Thank
Mark.
you.
Can you just give us a history lesson here?
Well, what will be interesting about the coming debate over national health care reform is, are we as a nation finally going to join the rest of the industrialized world and have some kind of national health care program? There's different ways to do it and different opinions on that. The first major presidential candidate to talk about national health care reform was Teddy Roosevelt when he ran for president in 1912. So we've been fighting this fight for a century now. And hopefully we're going to make a major advance in this coming legislation that Congress is going to be drafting. The next major president to talk about it was Franklin Roosevelt in his New Deal package, and actually jettisoned national health insurance from that package so that the rest of the package could go through to provide things that we all now take for granted, such as Social Security, unemployment insurance, and so forth, a whole variety of programs that were part of the New Deal. And they were going to come back with a New Deal 2, which was going to include national health insurance. Unfortunately, the Second World War intervenes. Then President Roosevelt died in office. The next president to talk about national...
But what about who the major force, the major opposition to Franklin Roosevelt was?
That's true.
And Frances Perkins' key role, Secretary of Labor, who was the one really pushing for national health reform.
She was absolutely pushing it. But the main reason they jettisoned it was the American Medical Association came out and said that they didn't think that government had a role in assuring health care for all Americans. And really what that was all about was they're afraid of interference with the practice of medicine, which I think is a legitimate concern to some extent. But to many of us, what that's really about is trying to protect their prerogatives about setting the rates they charge patients.
And then through the Truman administration, they continued to maintain their opposition to any kind of health insurance as well?
Then President Truman came forward with a national health insurance program, and it was again stopped by the AMA, and the insurance industry joined them. And this was during the Red Scare period, and it was branded as socialized medicine, and we didn't want...
Was Truman branded as a socialist?
I don't know whether he actually was personally or not. I'm sure there were people who said that about him in this context. That wouldn't surprise me at all.
One of the surprising things apparently is the AMA also even opposed the development of health maintenance organizations later on?
Yeah, which we all now think is a pretty conservative approach to health care. But at that time, that was considered a really radical socialist idea that people would get together and prepaid group cooperatives to buy health care from providers.
So you have the AMA opposing FDR and any kind of national health insurance, as well opposing President Truman and winning. Well, in 1961, the AMA organized a campaign to block Medicare titled Operation Coffee Cup. The campaign stressed that the government-sponsored system would lead to socialism. For a spokesman, the group turned to Ronald Reagan, then a famous actor who just begun to launch his political career. Reagan lent his voice to a 10-minute-plus recording distributed by the AMA.
One of the traditional methods of imposing statism or socialism on a people has been by way of medicine. It's very easy to disguise a medical program as a humanitarian project. Most people are a little reluctant to oppose anything that suggests medical care for people who possibly can't afford it. But let's also look from the other side at the freedom the doctor loses. A doctor would be reluctant to say this. Well, like you, I'm only a patient, so I can say it in his behalf. The doctor begins to lose freedoms. It's like telling a lie, and one leads to another. First, you decide that the doctor can have so many patients. They're equally divided among the various doctors by the government. But then the doctors aren't equally divided geographically. So a doctor decides he wants to practice in one town, and the government has to say to him, you can't live in that town. They already have enough doctors. You have to go someplace else. And from here, it's only a short step to dictating where he will go. You and I can do this. The only way we can do it is by writing to our congressman, even if we believe that he's on our side to begin with, write to strengthen his hand, give him the ability to stand before his colleagues in Congress and say, I have heard from my constituents and this is what they want. Write those letters now, call your friends and tell them to write them. If you don't, this program, I promise you, will pass just as surely as the sun will come up tomorrow. And behind it will come other federal programs that will invade every area of freedom as we have known it in this country. Until, one day, as Norman Thomas said, we will awake to find that we have socialism. And if you don't do this, and if I don't do it, one of these days, you and I are going to spend our sunset years telling our children and our children's children what it once was like in America when men were free.
Yes, the voice of actor Ronald Reagan, employed by the American Medical Association in their campaign entitled Operation Coffee Cup, to stress that the government-sponsored health insurance system would lead to a form of socialism. Mark Haney, take us through history from there.
I just have to laugh listening to that. It's such beautifully crafted rhetoric. But just moving forward, so this was at the beginning of the fight for Medicare in the 1960s, when this was distributed to the American Medical Association members, who at that point represented the vast, vast majority of physicians, which they do not anymore today. So it had an impact of a sort. President Johnson did enact with Congress the Medicare and Medicaid program over the opposition of again, the American Medical Association, the insurance industry. And this time what was sort of interesting about the creation of Medicare and Medicaid at that time is that there was opposition from Democratic senators from the South, because what those programs meant was that they were going to have to integrate healthcare facilities and hospitals, in particular in the South. So he was able to overcome those barriers. And that's also kind of why we got the Medicaid program separate from Medicare. It was for poor people, so there was a way to kind of, if you will, segment out poor people, and particularly in some communities, people of color, out from the regular mainstream system that the government was creating. The hospitals, interestingly, were on board for the creation of the Medicare and Medicaid programs because they were the ones getting stuck with all the uncompensated care. So it was an interesting dynamic where you had the hospitals and the doctors pitted against each other. But the doctors oftentimes sort of ran the hospitals, so it was kind of an interesting sort of situation.
And what has kept the American Medical Association